Lexicomp by Samantha Aguirre, St. Petersburg College. Purpose: to provide the necessary tools in helping improve patient safety, ensuring compliance, and enhancing the care quality that patients receive. Lexicomp is a pharmacology resource by Walter Kluwer's Health that is useful for nurses, physicians, physician assistants, pharmacists, dental professionals, and students for the most up-to-date pharmacology-related information. For better patient safety, having access to a drug information reference can be a main factor in improving patient care. Lexicomp is reliable, having a database that is updated daily. Lexicomp is quick, complete, and accurate, being trusted by 90% of top American pharmacy schools as a drug reference. The benefits of using drug database references include increased drug knowledge, better drug-related decision-making, and being able to avoid or reduce adverse drug events. These are the many tools available in the use of Lexicomp. Point-of-care pharmacology is in reference to the multiple aspects that Lexicomp offers information on. This includes adults, pediatrics, and geriatrics. Dosing gives information on population-specific dosaging and adjustments related to renal and hepatic function. Warnings are given for specific diseases or drugs. Adverse reactions are listed as the potential problems a patient may experience. Interactions are identified with other drugs, herbs, or foods that may cause a potential issue. The indication and uses give a detailed description of what the FDA-approved use is, as well as the off-label use. The compatibility with IV solutions are detailed. Administration information is listed from the different routes to information on the monitoring parameters. Specific population calculations and infusion information are identified. Drug identification shows that a unique description of the drug inclusive of the multiple manufacturers that a drug may have. Patient education gives information on everything a patient should know about the medication that they are receiving. There is access to more than 900 medical conditions per the 5-minute clinical consult with valuable information. International drug names are given for each specific medication. Pre- and post-administration monitoring of lab values are specified. The signs, symptoms, and treatment of common overdoses and poisonings are outlined. Lexicomp is compatible with Android, iPhone, iPod Touch, and iPad. The layout is different dependent upon which device the application is utilized on. Lexicomp has an outline index for quick reference, although familiarity with the application may affect usefulness. Navigation of Lexicomp is easy to learn. The links for choosing the information you need are categorized, making information simple to look up. Access is direct, and the process of entering and receiving data is quick, making workflow productive, and being overall a great asset to nursing care. Information received is clear, concise, and thorough. Lexicomp will issue a license so long as the terms and conditions are accepted. The terms and conditions are divided into 11 subsections. The license subsection emphasizes that one shall not copy, sell, modify, or redistribute the software. Termination of the agreement may be made by an individual or by Lexicomp, and discontinuation of access will occur. Software and all of its content is copyrighted. The content of Lexicomp is not 100% guaranteed. Professional judgment should be used in lieu of information in the database, as each patient's situation may differ or newer knowledge may be available. Lexicomp is to be held harmless for any claims made, and the account holder will assume responsibility for using the information appropriately. Liability will not exceed any damage fees paid. Beta versions may contain different features and expire at the end of the indicated period. The user is responsible for monitoring their account and ensuring that no unauthorized person accesses the software. The user must agree to pay all fees. Lexicomp has the right to change the terms and conditions. Overall, the benefits of having access outweigh the limitations. Lexicomp is pricey, but the information is invaluable in clinical practice. The system is easy to use, and the knowledge gained is practical. Other than pricing, another limitation can be mobile access. Lexicomp has decided to stop supporting other mobile systems, such as BlackBerry. Having used Lexicomp in clinical setting, I would have to recommend it. It is a daily tool that I utilize, especially on drugs that I have limited familiarity with. I feel that it has improved my nursing and allows me confidence in administering medications. Lexicomp improves patient safety by giving access to the most up-to-date pharmacological information. Lexicomp is useful to nurses by improving understanding of specific drugs used in clinical practice. Lexicomp improves nursing overall. Nurses are more aware of potential side effects and adverse reactions, as well as informed on monitoring parameters and administration information. Nurses are able to properly educate their patients and have an understanding of the use of the drug. Lexicomp is a valuable resource and a great asset to the field of nursing.